Swachh Bharat. Importance of sanitation. Safe sanitation means promotion of safe disposal of human excreta, right use of toilet and avoiding open defecation as well as management of solid and liquid waste. Poor sanitation is a primary cause for deadly diseases, deaths among children under age 5, contamination of groundwater sources, loss of family income on account of increased health cost, and compromised human dignity. In managing safe sanitation at each level, household, community, and governments understanding impacts of poor sanitation, contribution of all key stakeholders, including communities, implementation of safe sanitation process is considered crucial. Impact on health. Exposure to contaminated drinking water sources and food with pathogen-laden human waste is a major cause of diarrhea and can be affected by cholera, trachoma, intestinal worms, malaria, ascariasis, etc. WHO observed that 1 gram of feces can contain 10 lakh virus and 1 crore bacteria, 1000 parasite cysts and 100 parasite eggs. Open and untreated human excreta can interact with food through soil, water, and crops unless this fecal oral route is broken through adopting safe sanitation and hygiene practices. Impact on children and women. Poor sanitation especially affects children under age of 5 as their immunity is not strong enough yet to fight the many diseases caused by poor sanitation. Severe diarrhea alone, the second biggest killer of children in developing countries, kills 1.5 million children each year. Research showed that long-term malnutrition as a result of parasites in the child's body prevents necessary physical and cognitive development and also leads to stagnant growth. Focusing sanitation alone can reduce many of these unwanted effects among children. Children falling frequently ill miss school, often leading to poor performance. An infected child is also likely to spread infections to his or her peers. When girl students reach adolescence, absence of separate and clean toilet facilities cause discomfort, discourage them to attend school while menstruating, and eventually drop out of school. In addition to health and social burden on young girls and women, poor sanitation also forces them to experience fear, shame, and harassment while having to defecate in the open. Impact on environment. Inadequate sanitation and waste management have direct impacts on the environment. Untreated sewage flowing directly into water bodies affect coastal and marine ecosystems, contaminate soil and air, exposing millions to disease. Impact on economy. A study by the World Bank says that the absence of toilets and conventional sanitation cost India 6.4% of its GDP in 2006. The economic impact of poor sanitation for India is at least $38.5 billion every year under health, education, access time and tourism. Background of sanitation in India. The Rural Sanitation Program in India was introduced in the year 1954 as a part of the first 5-year plan of the Government of India. The 1981 census revealed rural sanitation coverage was only 1%. The International Decade for Drinking Water and Sanitation during 1981 to 90 began giving emphasis on rural sanitation. Government of India introduced the Central Rural Sanitation Program in 1986 primarily with the objective of improving the quality of life of the rural people and also to provide privacy and dignity to women. From 1999, a demand-driven approach under the Total Sanitation Campaign emphasized more on information, education and communication, human resource development, capacity development activities to increase awareness among the rural people and the generation of demand for sanitary facilities. This enhanced people's capacity to choose appropriate options through alternate delivery mechanisms as per their economic condition. Financial incentives were provided to below poverty line households for construction and usage of individual household latrines in recognition of their achievements. To generate awareness on sanitation, the first Nirmal Gram Puraskars were awarded to recognize the achievements and efforts made at the GP level in ensuring full sanitation coverage and achieving other indicators of open defecation free GPs. While the award gained popularity in bringing about a desire in the community for attaining Nirmal status, there have been issues of sustainability in some awardee GPs. The Nirmal Bharat Abhiyan, the successor program of the TSC, was launched from 1/4/2012. The objective was to accelerate the sanitation coverage in the rural areas so as to comprehensively cover the rural community through renewed strategies and saturation approach. Nirmal Bharat Abhiyan envisaged covering the entire community for saturated outcomes with a view to create Nirmal Gram Panchayats. Under NBA, the incentives for IHHLS were enhanced and further focused support was obtained from MGNREGS. However, there were implementation difficulties in convergence of NBA with MGNREGS as funding from different sources created delays. Bharat Mission. To accelerate the efforts to achieve universal sanitation coverage and to put focus on safe sanitation, the Prime Minister of India launched the Swachh Bharat Mission on 2nd October 2014. The mission coordinator shall be Secretary, Ministry of Drinking Water and Sanitation with two submissions, the Swachh Bharat Mission Gramin and the Swachh Bharat Mission Urban, which aims to achieve Swachh Bharat by 2019 as a fitting tribute to the 150th birth anniversary of Mahatma Gandhi, which in rural areas shall mean improving the levels of cleanliness in rural areas through solid and liquid waste management activities and making Gram Panchayats open defecation free, clean and sanitized. ODF would mean the termination of fecal oral transmission defined by no visible fecus found in the environment or village, and every household as well as public or community institutions using safe technology option for disposal of fecus as defined by the ministry. The mission shall strive for this by removing the bottlenecks that were hindering the progress, including partial funding for individual household latrines from MGNREGS and focusing on critical issues affecting outcomes. The guidelines of SBMG and the provisions hereunder are applicable with effect from 2/10/2014. Objectives. To achieve Swachh Bharat by 2019, the main objectives of the Swachh Bharat Mission Gramin are as under: bring about an improvement in the general quality of life in the rural areas by promoting cleanliness, hygiene and eliminating open defecation. Accelerate sanitation coverage in rural areas to achieve the vision of Swachh Bharat by 2nd October 2019. Motivate communities and Panchayat Raj institutions to adopt sustainable sanitation practices and facilitate this through awareness creation and health education. Encourage cost-effective and appropriate technologies for ecologically safe and sustainable sanitation. Develop wherever required community managed sanitation systems focusing on scientific solid and liquid waste management systems for overall cleanliness in the rural areas. Create significant positive impact on gender and promote social inclusion by improving sanitation, especially in marginalized communities. Strategy. The strategy is to move towards a Swachh Bharat by making it a mass movement that seeks to engage everyone in the task of cleaning homes, workplaces, villages, cities and surroundings in a collective quest. The focus is to provide flexibility to state governments, as sanitation is a state subject, to decide on their implementation policy, use of funds and mechanisms, taking into account state-specific requirements. This is to enable states to develop an implementation framework that can utilize the provisions under the mission effectively and maximize the impact of the interventions. The Government of India's role would be to complement the efforts of the state governments through the focused program being given the status of a mission, recognizing its dire need for the country. The key elements of the strategy include augmenting the institutional capacity of districts for undertaking intensive behavior change activities at the grassroots level, strengthening the capacities of implementing agencies to roll out the program in a time-bound manner and to measure collective outcomes, incentivizing the performance of state-level institutions to implement behavioral change activities in communities. Suggested that implementation framework of each state be prepared with a roadmap of activities covering the three important phases necessary for the program: planning phase, implementation phase, sustainability phase. Each of these phases will have activities that need to be specifically catered for with concrete plans of action which shall need specific preparation and planning. State level planning. A project proposal shall be prepared by the district incorporating Gram Panchayat wise details and scrutinized and consolidated by the state government into a state plan. Plans shall provide details of the IEC, BCC, triggering exercise, capacity building, implementation, financial support and monitoring activities planned in each district consolidated for all Gram Panchayats. The state plan will be shared with the Government of India, Swachh Bharat Mission, Gramin, Ministry of Drinking Water and Sanitation. The plan will include a 5-year project implementation plan, along with 5 independent annual implementation plans. The state project implementation plans currently separated by states on a prospective basis shall be revised based on the baseline data and the revised norms of the SBMG. The AIP plans shall be approved by the ministry each year. An annual communication plan should also be included in the AIP of all states. On the basis of formative research and consultation rounds, the state shall develop a tailor-made communication strategy, a communication plan and material, and will train community mobilizers to use these tools. The states will be allowed to make inter-district changes in allocation of resources to the individual districts within the overall funding of the state as per the approved annual implementation plan. The baseline survey data from 2013 collected and entered by states on the IMIS of MDWS by 31/1/2015 will be considered as the base for all states whose survey is complete. For other states, the data entered on completion of the survey will be taken as the base data. District level planning. For purposes of effective planning and implementation of SBMG, it is proposed that district be considered the base unit of intervention with the goal of creating ODF GPs. The district collectors, magistrates, CEOs of Zilla Panchayats are expected to lead the mission so as to facilitate district-wide planning of the mission and optimum utilization of the resources. Each district is expected to undertake a strategic planning exercise to make the district open defecation free in a time-bound manner. It is suggested that the districts develop a district Swachh plan DSP for the rest of the mission period against which monitoring will be done. The DSP exercise should include establishing the baseline status, scope of work for making the district ODF, timelines, arrangement for implementation of behavior change initiatives and construction of toilets. Capacities needed to undertake the task should be ascertained and reflected. Plan and arrangements for important tasks like demand generation, choice of technology, construction supervision, geotagging of toilets, conversion of insanitary to sanitary toilets, making defunct toilets functional, verification of ODF declared villages, etc. are to be indicated in the district Swachh plan. The plan is to be prepared in a consultative manner such that ownership is ensured from all stakeholders.